Hello, my name is Dr. Mickey Guiberteau, and I'm a professor of radiology at Baylor College of Medicine in Houston. And today I'm going to speak to you about the value of our national radiology organizations in your career. One of the transitions in life that I remember vividly, and you will, I'm sure at some time, is moving from being a resident and fellow to what some call independent practice. On one hand, it's very exhilarating. There are no more checkouts, no more supervision is required, and we're finally on our own. But on the other hand, independence comes with many new responsibilities, not the least of which is managing our professional development to stay at the top of our game throughout our careers. And this requires some planning. Most of you are going to be very busy in practice. There'll be no more teaching conferences 2 or 3 times a day, no protected time to read and learn, no access to a host of expert faculty. So the question is, how will you keep your clinical skills sharp and learn new ones in the future? Fortunately, in my practice, I had a mentor who helped me greatly in terms of negotiating this transition, and it gave me what I believe very good advice, which I'm going to pass on to you. One of the most valuable assets in this transition is to take advantage of the resources and offerings of our national organizations. These organizations have served as the foundation of our profession for almost a century and now help to support us in the future. One of the strongest of these, and one that you will definitely have a long-term relationship with, is the American Board of Radiology. The ABR was created by radiologists for radiologists over 80 years ago, and it is charged with determining who is qualified to call themselves a radiologist. ABR provides you with perhaps the most important and universally accepted credential you will ever achieve, your ABR certification. This certificate serves as a testimony of your ongoing competence, and it opens and will continue to open many important doors throughout your career. Most residents I talk to view the ABR as simply a testing organization, and I know I did. In fact, it was somewhat intimidating at the time. But as practicing radiologists, it provides a program not only to retain the validity of our certificates, but to help us maintain and demonstrate our competence throughout our careers. This process is called Maintenance of Certification, or MOC for short, and you may be familiar with it. You're automatically enrolled in MOC after successfully completing your certifying examination. MOC is based on the same 6 competencies that are the fundamentals of residency education, and the program organizes these into 4 parts. Each part represents an important professional commitment. Part 1 is a commitment to professionalism, and this essentially is an assessment of your professional standing. Because this requires actual real knowledge of your ethical behavior to act in the best interests of patients, the ABR wisely depends on state medical boards to confirm to us that we are in good standing with the community by maintaining a valid, unrestricted license. Part 2 is a commitment to lifelong learning, and it is the core, really, of MOC, and it consists of a combination of CME, continual medical education, and self-assessment. Radiology is a rapidly changing high-technology specialty, as you know, and our knowledge quickly declines if we don't keep up or refresh it. Good patient care outcomes based on current knowledge is one of the important goals of the Institute of Medicine, and this goal has spread throughout our healthcare system, including to those who pay us. Lifelong learning is absolutely one of our strongest commitments as professionals. Part 3 of MOC is a commitment to knowledge assessment. This is where the examination part comes in. This means an independent external evaluation of what you know. In the past, this has been a traditional secure examination taken every 10 years. but it's recently transitioned to a continuous online assessment that you can do at home to get immediate feedback for your answers and to learn and close gaps in your knowledge as they come to you during the exam. ABR feels that this type of evaluation is really a better way to validate that we're keeping up in real time and not just catching up every 10 years. The final part of MOC is Part 4, and it's a commitment to improving the quality of health care. It's a universal, overarching goal of our time. Quality is considered a gateway to value in patient care and is becoming a primary ethic by which we are judged and paid. Transition from an emphasis on the volumes of our work to the quality of our work requires that we actually know how to improve the quality of our services. And Part 4 addresses this issue by requiring participation in activities that accomplish or promote quality improvement, often by what we do every day in our practices. A good way to think about MOC participation is as a framework to guide your professional development in the future. MOC is entirely designed to be customized to your practice. So by taking time to make it relevant to your practice, there are rewards that include staying at the top of your clinical game while at the same time learning to meet the latest external mandates of the healthcare system in which we practice. Strong national organizations are a very necessary part of being a strong profession. Besides the ABR, there are many others that provide us with unique professional development opportunities in education, medical economics, practice management, and many other practice-related efforts. These organizations have been responsible for the majority of our professional successes since our specialty was founded, and your support of these organizations is essential. When 30 to 40,000 radiology professionals speak with one voice, legislators, regulators, payers, and the public listen. And they listen when they're making policy decisions that may affect our future. Your membership adds your voice to these efforts, which include everything from how we practice every day to how and what we are paid for our services. These organizations are our opportunity to profoundly affect the quality of and the satisfaction we get from what we do in our professional lives. Sir William Osler, often called the father of modern medicine, was preparing to attend and participate in a medical society meeting when he was asked by a medical student what he thought he would get out of going. Without missing a beat, Osler replied, "Do you think I attend this meeting for what I can get out of it or what I can put into it?" If you don't participate or support those who do, it's hard to complain when things don't turn out the way you hoped. So my advice is definitely join up and participate if you can. It is an excellent investment in your future. Successful and fulfilling careers don't just happen, we make them happen. Because we're professionals, we maintain and improve our skills in radiology through continuous professional development. And because we're professionals, we also join and support our radiology organizations to keep our specialty strong. If you enjoy being a radiologist as much as I do, doing these things is a very small price to pay for the many rewards we enjoy in return. I want to thank you for listening, and I hope you'll take time to think about what I've said. And last, I wish each of you a successful and satisfying career in radiology. Thank you.